Hello everyone, good evening. I am here with the I Care for Your Brain program. I am Dr. Sullivan, and I'm actually taping this a little bit earlier than we usually meet on Wednesday nights because I am going to be at a lecture up in Durham. And so what we're going to talk about tonight is the cognitive symptoms that are associated with mood symptoms. So instead of just thinking of things like depression and anxiety as feelings and things that affect the way that you feel, I'm going to try to help you understand tonight that we also need to broaden our definition to include cognition. So when we talk about cognition, what is it exactly that I am referencing? So if you look it up in the dictionary, the definition is activities of thinking, understanding, learning, and remembering. And this is a big part of what I assess and study and treat as a neuropsychologist. It's basically all the different things that our brain can do. And what I want you to understand, one of the big themes in this I Care for Your Brain program is that brain circuits, different parts of the brain, are sometimes specialized and really do have one job, but for the most part, one of the rules of brain function is that these circuits actually have many different jobs, and typically they work in triplicate. So one brain circuit is responsible for something physical, something in the mood realm, and also something cognitive. And so this is why when someone has a brain injury, we may just be able to see the physical symptoms, but almost always there are things going on cognitively and mood-wise because that part of the brain actually does it all. So this is why in so many neurological issues, Parkinson's disease is a great example, we see slowness in the body, but the truth is we also have a symptom called bradykapnia, which is slowness in thought. And sometimes we can have a little bit of depression with Parkinson's disease because there's also a little bit of a blunting and a flattening or kind of a slowness of emotions. So whatever neurological struggle it is that you have, I want you to kind of be trying to think about possible mood symptoms in a different way. So why does this matter? This is always a very important question to me. This is why I do these lectures, because I think it genuinely does matter for your quality of life, for understanding what's going on with you. As you guys know, I'm such a big believer in that. If you don't have answers, if you don't have good quality information and education, you're not going to understand. And how can you then hope that people around you, like your family, will understand? I think a part of your job after any kind of a brain injury is, as much as you are able, to learn about what has happened to you so you can have a starting point in where to go in your treatment, to increase your self-compassion, to understand exactly the changes that have happened, and to communicate these to other people. So the first thing I think about is how important it is to understand mood symptoms, because it really does add an extra layer of disability if it goes unrecognized or untreated. So in so many people that come to see me as a neuropsychologist who have, let's just say, memory complaints, so often, yes, there may be a, quote, neurological reason. Maybe there is some early dementia, or maybe there has been a stroke, or there has been a car accident and they had a traumatic brain injury. But so many times there are also other layers. When I do my talks, I often have this picture, this cute, funny picture of like a 16-layer cake. And I try to make the point that almost never does someone come to see me and there's just one layer of a memory problem or a cognitive problem. There's almost always multiple layers. So one layer could be there's diabetes that's not well controlled. One layer can be that the person is isolated because they can't drive anymore. There is not good enough nutrition. There is trauma from the past that's weighing on them. And that's really the point of tonight, is how do these emotional things kind of take up real estate in our brain, which then makes us less able to pay attention and focus, because that's really the essence of the cognitive symptoms that happen with mood disorders. So my thought is that if we understand better, could we possibly take away a layer of unnecessary suffering, of additional cognitive symptoms and of a lack of empathy and understanding. So I think it's something that we need to talk about more, and as you guys know, those are my favorite topics. I want to shine some light on things that really matter to people, but maybe don't get enough face time with your doctors, or really not even addressed when you start to talk about what your treatment plan is. So if we can treat mood and appreciate it for what it really is and how it's influencing someone, I think we really have an opportunity that we might not have recognized before for how to help someone. So I know when you saw the ads for this talk, it said cognitive symptoms associated with depression and anxiety, but what happened was when I was starting to do my research for you, it became very clear to me that I need to separate these two to be able to keep this talk as good as it can be. So I am going to just be focusing on depression tonight, but what I'm going to do next time is actually just focus on anxiety. So instead of it being a 2-in-1, we're actually going to split them up. I hope that's okay with you, but I think they really each deserve the respect of their own prime time. So we're going to start with depression. Depression is something that has a prevalence rate of about 15% in the general population. And actually, according to the World Health Organization, it is one of the world's most disabling illnesses. And if you have experienced depression, you know exactly why this is. It is physically exhausting. It is very difficult emotionally. There's sadness, there's guilt, and there also is problems with our thinking. And so we need to understand that last one in a lot better detail. So the first thing I want to talk about with depression, and I really hope if you listen to my lectures, you are starting to think about psychology a little bit differently, which is that we really are kind of giving into an illusion if we talk about things as either or. You either have depression or you don't have depression. The truth is that all natural behavior is on a spectrum, and depression is no different. So within the world of depression, we actually have at least 5 diagnoses that kind of fall underneath this umbrella. So the first one, of course, is major depressive disorder. And I'm going to go through some of those symptoms with you in a minute. But we also have something called dysthymia, which is a really chronic, low-level kind of depression. Someone who's always just a step down. It never really gets to the point where they're kind of bottom of the barrel. Their everyday functioning is very, very reduced. But they never also really feel good and peaceful and comfortable. It's just kind of The next one is something called adjustment disorder with depressed mood, which any of you who have been through a medical crisis, I'm sure, have had at least this type of experience, which is basically something really happens in your life, and over the course of a month, 2 months, 3 months, you're just feeling very blah. There's some feelings of sadness that come and go. Just kind of, you know, this isn't normal for you. Your interest in things isn't quite there. But the key is it's related to something very specific that happened. And over time, you actually kind of bounce back and start to feel more like yourself. We also have depression with psychotic features, which is when someone is so depressed, they actually start to have auditory hallucinations, they can become paranoid and even have delusions. So the point of that is just to say someone with depression could fall anywhere within that spectrum. Depression can be one time in someone's life, it can be reoccurrent, it can vary in severity all the way from mild up to severe. But for most people, unfortunately, once you have one major depressive episode, you are more likely to have another one in the future. So I want to go through some of the symptoms, the criteria of major depressive disorder with you from something called the DSM-5, which is kind of the grand dame Bible of psychology. And what they tell us is that you have to have 5 or more of a set of symptoms that have to be present during the same 2-week period, have to represent a change from the way someone was before, and at least one of their symptoms has to be depressed mood, which is feeling down, sad, or a loss of interest or pleasure in something that they used to enjoy. These symptoms have to cause distress in someone's everyday life, and that's a theme too that we've been talking about, that when something is going on with the brain, it really becomes diagnosable when it interferes with your ability to work, your ability to be in relationships in a way that you are comfortable with, any important area of your functioning. These symptoms cannot be attributable to another physiological cause, which gets complicated when you've had a brain issue, and this is really the area of expertise of neuropsychology. And this is a huge part of why I'm doing these lectures, is I want you to know about my field, my loves of neuropsychology, because we specialize in these things, and I know so many of you out there are living in this world of, is it a brain thing? Is it a mood thing? And the truth is, a neuropsychologist is the provider that can help you the best, in my humble opinion. So let's go through some of these symptoms. So depressed mood, most of the day, nearly every day. So this is feelings of sadness, emptiness, hopelessness. And either this can be you notice it yourself or other people notice this about you. There is a significant decrease in interest or pleasure in all or almost all activities. Again, can be your subjective account or someone else. And people either can lose a bunch of weight, can gain a bunch of weight, can sleep too little, can sleep too much, can be kind of agitated physically or actually really down physically. So this is kind of like having a hard time getting out of bed, hard time getting off the couch. Feelings of worthlessness or guilt that are really inappropriate to the person's history. Recurrent thoughts of death, suicidal ideation, these kind of things. Then there is one cognitive symptom that is listed, which is the decrease inability to concentrate or feeling indecisive, which means difficulty making decisions. Feeling like I don't know which one to pick because what if I pick the wrong one? And that just kind of confirms that I'm ineffective and I don't know how to make decisions. So what can happen is people wind up not making any decisions, which of course can kind of keep them stuck. So I think having one out of those possible, 9 or 10 symptoms is actually kind of an underestimate. I think for many people out there, they would tell you that the brain symptoms, which sometimes get referred to as brain fog, are actually very prominent for them. And I'm going to share some data with you in a minute that is really pretty fascinating and important, which tells us even when people are well treated and quote unquote recover from depression, the one symptom cluster that actually is very stubborn to go away are these cognitive symptoms. Okay. So let's talk about them in a little bit more detail. So I think most people would tell you that really it comes down to trouble in concentrating, sticking with a task for a significant amount of time, feeling very distractible, having a reduction in reaction time. So just everything feels like you're walking through molasses, very, very slow. That indecisiveness, and also short-term memory loss. So typically the long-term memories are so well established in our brain, that's not really an issue. But the problem is that attention and concentration are the gateways, are the bridge to get to memory. So what we think is that it's not necessarily a true memory problem like you would see in something like Alzheimer's disease, but it's that we can't focus long enough to actually make the memory. And we need to talk about why this is happening. The other thing that's important to know is that in depression, one of the issues, which is what is exactly is the focus in something called cognitive behavioral therapy, is that the truth is that depressed people do focus more on the negative. They focus more on the threat. It's the old glass half empty, glass half full. And the idea is that we know from research that people really do gravitate more towards the negative or the threatening information. And probably it's because they're in a vulnerable position and there's this kind of survival feeling. Your brain is actually pushing you to do this because you need to make sure that you're on top of any threat that's potentially happening. Why this is important, though, is it begs the question that are these cognitive symptoms subjective, meaning the person is feeling them, they're very real to the person, or are they objective, which means if you were to actually test them and they were able to give you good effort and really try, would you actually find that they really do have cognitive symptoms? Or is it just they're so prone to kind of seeing the negative and the problem that they're kind of prejudiced towards that? So what the research tells us is that the cognitive symptoms in depression are genuine, that this is not just the person kind of being negative and seeing things in a threatening manner. We do think, though, the real problem can be exacerbated, that the person can become kind of hyper-focused on the problem, and that's a part of treatment. When I get to that part of this talk, is how do we kind of get people unstuck? And is that problem with getting unstuck, the switching, multitasking, kind of getting into a rut cognitively, is that actually a big part of the problem? Because we can't just pull ourselves away. There's something about depression that is very magnetic, in a sense, where people desperately want to be better, they desperately want to feel better, but something about the brain disturbance, it's just, it makes it so hard to get unstuck. So we know that depression, the cognitive symptoms of depression are there no matter the age of the person, no matter how severe they're depressed. So even mild symptoms of depression have these cognitive symptoms. So why is this happening? This is something I always want to know. Well, there's not really any clear answers. So in essence, how we think of it is that there's some kind of thought emotion disturbance between the cortex of the brain, kind of the thinking cognitive part, and the inside part of the brain called the subcortical area that has a lot of our emotional centers. And there's something going on there. We think primarily in the prefrontal cortex, specifically what we call the dorsal and the ventral aspects, that basically does something wrong in the realms of motivation, decision-making, multitasking, and kind of low, poor mood. There's some kind of problem there. So, that's one theory. The other theory is that many studies have suggested that the physical symptoms of depression, which are the very low energy, feeling very blah, almost like you have a chronic low-level flu, is in part due to inflammation. So the question is, though, is we have a chicken or the egg phenomenon, right? Is there inflammation? Because one of the ways we self-treat for any kind of mood disturbance is we basically eat unhealthy things. I mean, how many times when you're feeling low do you want a bowl of mashed potatoes or a grilled cheese sandwich? I know I certainly do. And these things can lead to systemic inflammation throughout all of our body. So some people are questioning, could the same thing be happening in the cognitive symptoms? We really don't know. There's a researcher up in Boston, I think it's Harvard Medical School, who really feels like why the cognitive symptoms happen is due to difficulty with what we call cognitive flexibility, which he's basically saying that you get into one way of thinking about something and it's really hard to switch your attention to something else. So once you kind of fall into a negative thinking pattern, it's really, really, really hard to train yourself to see things in a more realistic or balanced way. So about 80% of people with major depressive disorder report that they have trouble doing their jobs because of the cognitive symptoms. And what we think is that maybe this is actually a reason for relapse. Remember I was saying before that once you've had a major depressive disorder, unfortunately you're more likely to have one. So some people think that this relapse is because, remember I was saying before, the cognitive symptoms don't actually seem to go away with successful treatment. So we know that antidepressants are actually pretty darn good at helping with the emotional and the physical symptoms that go along with depression. Unfortunately, cognitive symptoms are right up there with people who say, you know what, I don't feel depressed, but I feel like that brain fog, that trouble focusing. I'm just not back to where I was before. So there was one study that looked at a group of people who had major depressive disorder, and they took antidepressants, and after about 3 months, they were considered to be completely in remission, or at least partially in remission. And 30 to 50% of them reported that they were still having cognitive symptoms to the degree that it interfered with their ability to work. That is pretty significant. And where we think this is really getting people is in this realm of executive functioning, which is complex planning, organization, multitasking. That is kind of the root of it. Sometimes what psychiatrists do is treat depression with antidepressants at first, and then once the mood symptoms are gone, they might sometimes actually move to something called a stimulant, which is kind of a medication that you might think of with a kid with attention deficit disorder. Some doctors feel very strongly that cardiovascular exercise and resistance training together is the only way to actually treat these cognitive symptoms. When I looked at this literature, I actually found there was a lot of studies that were kind of pro and a lot of studies that said, you know what, the truth is there's a lot of benefits to exercise, but we don't think it's actually getting to the cognitive symptoms. But as you guys are becoming more informed consumers of brain health news, you know that all of this depends on the quality of the study, how many people they had in the study, their inclusion criteria, you know, who they took, who they didn't take. So it's really hard to sometimes, even as a trained scientist, to look at the literature and feel like you know what actually works. But, you know, at the end of the day, what we really need, of course, is to expand our definition of what is depression, to not just be a mood thing, to not just be that you can't stop crying and that, you know, all these stereotypes and that you want to kill yourself. For so many people, it really lives up in the cognitive areas. So let's talk about, okay, now we know a little bit more. What should we do? What should we not do? So what not to do is actually very important, because when you feel so bad, when you are depressed, a big thing that happens is the why bother phenomenon. Nothing feels like it's worth the effort. There is an absolute draining of mental and physical energy for so many people that it's very easy to do things that actually make your mood worse. So the first thing that comes to my mind is the self-medicating. So not eating great things that, you know, high sugar, high carbs, that are going to actually maybe give you a little peak of energy, but the crash is really a huge price to pay. And drinking alcohol. Alcohol is a depressant. It may help numb out some feelings in the short term, but the truth is you're going to actually be more depressed the next day. Isolating yourself is a huge thing with depression. Either sometimes people feel like I don't want to bring other people down, or they just don't have the emotional energy. We all know people are difficult and can sometimes be draining, and I think when you have such limited mental and physical energy, the last thing you feel like you can handle is a lot of people or big conversations. The other thing is it's actually very tempting to spend time with negative people when you're depressed, because the truth is you kind of share the same worldview at that time, and you're not going to get feedback from them that you're being negative, or, you know, intervention that they would like you to try to think more positively and be more like your old self. But the truth is, a lot of social psychology research tells us that we take on a lot of the behaviors of the people closest to us. So I want you to really make an effort to, you know, you don't have to go around trying to find shiny, happy people, but the truth is you need to be, your inner circle needs to be people that are working at least on being mentally healthy. The next one is to, you know, not try to make big decisions or engage in hard cognitive tasks when you are tired, when it's the end of the day, when you're feeling like this brain fog is really strong. You want to try to figure out what's your best time of the day. That's when you want to try to pay the bills, you know, schedule important meetings. You're just really going to feel worse about yourself if you try to do these hard things when you're already down a couple notches in terms of your energy level. Eating an anti-inflammatory diet, I think, is very wise. My talk I'm actually giving in a couple hours today is all about how heart health relates to brain health. And so much of what happens to us has to do with how good the circulation is in our body and specifically into our brain. So that's just a good recommendation in general for brain health. But there are some suggestions, like I said, that depression and inflammation have a lot of touching points. So that is a great kind of overall thing that you could be doing for yourself. Certainly there's enough research to suggest that exercise is very, very good for the physical symptoms of depression, but also there's enough where I feel comfortable telling you for those brain fog symptoms, I think it would be good. And you know, one thing I always say is you don't need to make a huge big deal out of exercising, like go get a trainer and even join a gym. Really, walking, if you're able, is a phenomenal way of getting exercise. Chair exercise, if you are unable to be as mobile as you would like, just sitting on the couch and actually raising your arms up and down, marching in place if you can, having people kind of help you with stretching, anything that you can do that's physical that gets your heart pumping is going to get more blood and oxygen to your brain. The other thing is that if you are having these symptoms, you're going to have to develop external ways of supporting that prefrontal cortex that's having a problem. So you might already do this. This is getting comfortable using calendars, phone reminders, stickies, all those things you used to be able to do inside. You're going to have to do them on the outside and really work hard to have a system of organization that works for you. In terms of neuroplasticity and brain games, we're all very interested in these things nowadays. I was trying to think of something that would work on those brain circuits that we know are involved with depression. And really cognitively, what it comes down to is this whole multitasking thing, switching back and forth. So this might sound kind of funny, but you know, there's the Simon game, and you can actually get it on Amazon, where it will put a pattern of colored lights and you have to go in and tap it. That would actually really get at that part of the brain because there's a lot of starting and stopping and concentration and focus. So the theory behind all these brain games is that you basically are activating those circuits, and that over time that they're then going to get more chemical energy, more electrical energy, and kind of build up a certain amount of strength. So what we want to do is making sure in depression that we're not just avoiding difficult cognitive tasks because they feel too overwhelming. At least for a certain part of the day, I want you to either find some kind of a brain game where you feel like you are doing a little bit of switching back and forth, or just, you know, your work. If you're able to be out there holding a job, you know, really try at times to try to focus on first things first. The last recommendation is, of course, to consider a neuropsychologist, especially if you've ever had a brain health challenge like a stroke, a traumatic brain injury. We really are the experts at teasing apart the layers, right? And one of my big philosophies is that you have to have the map of where you're at now to inform where you need to go in the future. I think so many of you are out there and you just haven't had a personalized assessment. You haven't had individual recommendations that are made to you that are unique to you. And I think that neuropsychologists, we have the time to do it. Our appointments are long. We see you for a in-depth assessment. We really, really care about the education piece. I think if you haven't seen one of us, you would actually find it to be a very fulfilling experience. So I always recommend, if you can find someone in your area who is board certified by the American Board of Professional Psychology, or what we call board eligible, which means they have all the credentials, but it does take a couple of years to work through the process of being board certified. So just making sure you're really finding a true expert in this subspecialty, I think, is very important. If you go on Google, you can actually put in, find a board certified neuropsychologist, and there's a great website. You can put in a zip code and it will give you the people in your area. If you have a hard time, you can always private message me on this page, and me or the lovely people that work with me will be more than happy to try to find you someone. So let's talk about next week. So remember, I said we're gonna parcel apart depression and anxiety. Well, these two things come together. 60% of people who report having depression also have anxiety. So it's not going to be an either or. And what we're going to talk about next time is how anxiety really takes up real estate up here and prevents you from being able to take in new information. And of course, try to help you understand what to do about it. If you found this talk helpful, if you feel like you love getting this kind of in-depth information, I would love for you to do two things. One would be to share it on your wall so other people can learn. And the second thing would be, if you were so inclined, to leave us a review here on our Facebook page. We have a couple things in the works behind the scenes that involve trying to get our information to you in maybe a little bit of a different way, and leaving reviews and helping support this page would maybe help us get some sponsorship support so that I would be more able to bring you important information. So hopefully that wasn't too vague, and you can kind of put two and two together there. We are still working fast and furious to finish up our stroke recovery guide. I'm so excited to get that out there to you guys. We'll be talking about that in the next few weeks. But until then, I hope you have a great rest of your day, and thank you so much for listening. Bye-bye.